Board members, while we're waiting for this to start, let me go ahead and remind you, since we're a few people short, that although you do have a quorum tonight of 7, your 7 members does meet the quorum requirement of 5 members, that anything you pass must pass with a majority of the membership. That is, regardless of the number of people attending the meeting, you need 5 votes to pass anything. So a vote of 4 to 3 would still be a failing vote.
Hey, one more second. And Dr. Buchanan's, I think she might have just popped in. It just kept saying joining for her. So we've got her, and then Dr. O'Brien did say that he's going to be a little bit late this evening. And we just had some folks pop in to try to help with our YouTube. So if you guys, just another minute, if not, we'll go. We're at least recording here right now, I believe. Does it say?
We're recording.
So I think we'll be okay, but we just want to try to get it to the YouTube link.
Charity, let me know when, from all standpoints, we're good to go and we can start.
Yes, sir, will do.
Yeah, she might have to also call in.
Dr. Buchanan, we see you in while we're trying to get this worked out. Can you hear us? And can you speak? We can't talk to you right now. Or we can't see that you're unmuted.
I can hear you, Charity. Are you speaking to me?
Yes, I was. Yay. Okay.
Sorry, I had some trouble. I don't know what happened.
Okay. So one issue down, I think.
Give us that one more minute.
One more minute. I'm going to go do a status check outside and see where we are.
Hey, Danielle, can you still not hear me?
Yes, we can hear you, Dr. B. We are working on trying to get on YouTube right now. We're having some issues.
Okay. I'll mute myself then.
Oh, shit, that's damage up to.
All right, just to make sure we're okay. So they're still working on it, but Mr. Sanders or anybody else, it's streaming on CTV and we're recording here, and they can get the YouTube link hopefully up soon. Or do you guys think it's okay to go ahead and move forward based on where it's showing so far?
No, I think it's a public meeting and we need to wait until we have public access.
Okay.
We have CTV.
CTV is going, but more.
Oh, is it? Okay, I wasn't aware of that.
Yes.
I'm sorry. I guess you told me I wasn't clear on that. No, as long as CTV is going, I think you're okay to start. I just don't think that if nobody in the public can see it, then you have an issue.
I understand. So you think we're okay? I believe we're good. And my understanding is CTV is going.
Okay. Do we have just a comment? Do we have any idea about how many people see us via YouTube? Is it useful to wait until we get on with YouTube, or how does that work?
Yeah, I don't know the answer to that question. I don't know if anybody else on the call might.
This is Zach with County IT. We're really close on the YouTube link. We think if you can give us just a minute or so more, then we'll know for sure if it's going to work.
Okay.
No problem.
Okay, this is Zach. We've switched to a different system entirely and had the same error. So what we're going to do is just roll with it as is on CTV, and then once the recording is complete, we will post that video to YouTube. If for those viewers, if
That sounds good. That sounds good, actually, Zach. Because I like how people have, YouTube capability, but if we can do it in real time, great. If we can't, as long as we have it,
yeah,
so they can access it, or CTV, I think that would be fine.
Yeah, and we'll continue working the issue in the background. If we get it going, we'll let you know. But we apologize.
Okay, no problem. So with that, it looks like we can have a call to order of the August 26th meeting. And first order of business is roll call. And Charity, if I can have you go through the roll with us.
Yes, sir. Dr. Drake?
Here.
Dr. Gocher?
Here.
Dr. Hurt?
Here.
Mayor Jacobs?
Here.
Dr. O'Brien? He's going to be late. Dr. Shamia?
Here.
Dr. Souza?
Here.
Ms. Wagner?
Present.
Dr. Buchanan?
Present.
Thank you. All righty.
So
Everybody, we're missing
we've
one.
established a quorum because we're only down one member who will join us. So the next order of business will be approval of the minutes of the August 19th, 2020 meeting. And I believe everyone has received a copy, either electronically or printed, of that meeting. Are there any additions, corrections, anything that needs to be done in terms of alteration of those minutes? If not, I'll entertain a motion to approve those minutes, and a second, please.
I move to
Make a
approve.
motion, we approve the minutes of last week's meeting.
I'll second.
Thank you. Any other discussion on that? If not, all in favor, and let's go through the roll call again, Charity. Thank you.
All right. Dr. Drake?
Yes.
Dr. Gocher?
I approve.
Dr. Hurt?
Approve.
Mayor Jacobs?
Yes.
Dr. Shamia?
Yes.
Dr. Souza?
Yes.
Ms. Wagner?
Yes.
I'll do Dr. Buchanan. That's it. Passed with everyone that's present.
Thank you. Next item is to set the agenda, and you should have a copy of the agenda before you. And I will entertain a motion for approval of the agenda in a second, and we can discuss it if there's changes that we need to look at.
Move to approve.
I'll second.
We have a motion and a second. Are there any points of discussion on the agenda for this evening?
On this might fit under other business, but I think that we've told the public that we would discuss the mask mandate every week or every other week. So do we need to add that?
I would be happy to add that to other business, and we could have that if our committee desires to have it the first thing that comes out of other business. So with that amended, I guess we should have a vote on that.
Hey, this is Martha. I'm sorry. This is Dr. Buchanan. I'm still driving. Actually, and I'd have to look at the minutes. We kind of decided that if there were issues, we'd discuss it. But if we want to start discussing it at every meeting, we certainly can do that. But that's why it wasn't on the agenda, was because we said if there's an issue, we'll discuss it. But but we can add it back to the agenda. That's fine.
Okay. So I guess we can go through a voice vote for it, and then we'll go through one more voice vote to approve the agenda, and then we can get going. So, Charity, one more time, actually 2 more times.
Dr. Gocher, could I just, before we do that, just so we don't have to do it, I just want to just to clarify, I've got a few things in my mind, just really for discussion, that I was just going to include in other business without formally necessarily adding to the agenda. So is that still okay if we've got something on our mind?
I would think it would be okay. I mean, I think that's the topic of other business, but I think Mayor Jacobs' point about wanting to not bury that or forget about that is a very wise point. So we can pull that one out. And
understood.
In other business, I have sort of jotted down about 4 or 5 more topics that probably bear discussion through the week, and you all may have others as well.
Thank you.
Okay. So Charity, let's go through a voice or a roll call vote for that addition to the agenda and then the agenda itself.
Okay. Dr. Drake.
Yes.
Dr. Gocher.
Yes.
Dr. Hurt.
Yes.
Mayor Jacobs.
Yes.
Dr. Shamia.
Yes.
Dr. Souza.
Yes.
Ms. Wagner.
Yes.
All right. I'll pass with everyone present.
Okay. So the next item would be approval of the agenda. And I don't recall if we had a motion and a second on that. I think we did.
Yes, sir. We had Dr. Shamia, I believe, and then Dr. Souza was the second.
That's right. That's right. So any other discussion on the agenda itself as amended? If not, let's have another roll call on that, Charity.
Yes, sir. Dr. Drake.
Yes.
Dr. Gocher.
Yes.
Dr. Hurt.
Yes.
Mayor Jacobs.
Yes.
Oh, sorry. Dr. Shamia.
Yes.
Dr. Souza.
Yes.
Ms. Wagner.
Yes.
All right.
Thanks, everyone. With the approved agenda, the next item is item number 6, which is Knox County Health Department benchmark presentation. And I don't know whether this will be Dr. Buchanan or this will be Charity. Who will be doing it? Charity, are you doing it today?
Yes, sir.
Okay, great. So.
All right, I think we're getting it pulled up right now. While she's pulling it up, we'll talk about our local situation today. Really good news to report. We had 34 new confirmed cases since yesterday's report, giving us 6,063 confirmed cases since March. Additionally, we've had 223 probable cases. 4,116 of our cases have recovered, giving us 2,115 active cases. 255 individuals have been hospitalized at some point in their illness, and 31 Knox County residents are currently hospitalized. And we are grateful to report that we have no additional deaths today, and that's keeping our total at 55. And so then moving into the benchmarks, our first benchmark is the sustained reduction or stability in new cases for 14 days. We did see 3 flags on this, but not in consecutive days. And that is kind of standard when we're seeing, if you've noticed, our numbers are kind of, if you kind of go down to the next one, Catherine, it'll show it a little more clear, but our numbers have been bouncing up and down. Oh, I'm sorry, it's up on the above one a bit. So that's to be expected. And because of this, though, when you look at the overall cases and new cases that we're having every day, we are representing this benchmark as green. So we have not had any consecutive days of concerning flags at all. And overall downward trend we're very happy with. Our second benchmark is community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. And from the data that we can see, the trends are heading in the right direction here. We did see a few flags, but not on consecutive days. The number of tests conducted continues to trend consistently, and the lab turnaround time also is remaining consistent and dropping down. You can see there was a little bit of a dip last week in the amount of tests that we did, but I think that's probably out of, if we scroll over, can you highlight over the last week's numbers? The one before that. 4,136, and the week before that, I think it's about 300 tests different. If you look at that, 300 to 400. So not a huge difference there, not enough to make any large flags. So we are representing that benchmark as green as well. And if you see it, if you hover over the boxes at the bottom on the specimen collection time, we're down to, I believe, less than 2 days now. That was this week, which that data is a little iffy, but the previous week, I still think, yeah, we're just under 2 days on that. Our third benchmark, sustained or increased public health capability. For this one, we aim to investigate or initiate investigations for new cases within 24 hours and close contacts within 48 hours. And since March, we have done that within 24 hours for a little over 99.5% of our cases. And because of that, we are representing that benchmark as green. The reason you see the little bit of a dip there is 2 weeks ago, you guys might remember we had some discussion, and I mentioned that some of our cases we had routed directly to Tennessee Department of Health to allow some of our staff to try to return to some other critical public health practices. It is important to note that those cases that have been sent to them have very strict criteria that would allow, the cases they could investigate were kind of our lower risk cases. They were in lower risk age groups. They couldn't